Hi, I'm Dr. Rudy Cashman, neurosurgeon in Fort Wayne, Indiana, for 41 years. But I'm only 39 years old. Kidding, of course. Of major interest to me, frankly, has been the subject of wellness. I noticed over the years that 50 to 75% of the patients that I'm looking at, all they need is a coach. They just need to be coached. They don't need an injection. They don't need an operation. They don't need narcotics. So I'm still practicing full-time neurosurgery, but 50, 75% of the people I send to my wellness studio, which I have right at Lutheran hospitals. I have CDs, DVDs, books, TV show now. I'm trying to teach the people out there how to get to wellness. It's less risky, less costly, almost without complications. Call me Dr. Wellness. That's fine. I'm proud of it. I'm Dr. Wellness and still a full-time practicing neurosurgeon. And with that, let's go on to this journey here. Holistic healing methods for chronic pain. What's holistic healing? Holistic healing really is to take in consideration the patient's physiology, what the problem is, the anatomy of it, but also his spirituality, and fully inform the patient as to what the condition is, and that they participate in the healing process. That's holistic healing. It isn't just you walk in, give your complaint, here's a prescription, see you later. That's what I'm trying to avoid. I would like the magical words for the medical provider to use, and I used it in a lecture yesterday. And what's going on in your life? I want to know what's going on in your life, unless you're hit by a train or fell out of an airplane. That's what I want to know before I want to discuss your medical condition. So holistic healing, really, you try to avoid and reduce medications. I see people in their 80s on 15 different medications. I see it commonly. This must stop. These medications are quite harmful. They're quite expensive. And I'm trying to avoid injections and operations, which I personally believe are a bit overdone today. I mean, I'm in the field. If I don't know, who frankly would know? Holistic healing has high safety, low cost. And it's a path to wellness. So if you come to see me for a single illness like a low back pain and you're overweight and you have type 2 diabetes, I don't look at you as just being a back problem. I look at the whole picture. And I, for example, may talk to you how to get rid of your type 2 diabetes, which I have a book coming out very shortly. It's finished. It's coming from the publisher within a month. How to eliminate type 2 diabetes in 60 days. So I'm about wellness. I'm not just about your backache. Probably your backache would go away if you exercise and we get your weight under control. You get rid of your diabetes and your back problem. I've seen that many times. So we're trying to avoid, stop, and reverse addictions of overeating and bad habits. What is pain? Let's talk about pain. This lecture is mainly about pain. It's a perception. It's your interpretation. You know, what's interesting is pain is interpreted differently, even among the sexes. Females, for example, are a little more sensitive to pain. You can put a woman's elbow in ice water. She'll withdraw it quite as fast as the men. That's nothing derogatory. It's just the way their body is built. The endorphins, their own morphine in the body doesn't work as good as in men, for example. Pain is an energy. It's a cognition. It's a recognition. And it's different among races, different among cultures. I talked to my fellow surgeons last night at a meeting, and we asked if they had ever known an Amish person come to see them about a pain problem or needing a back fusion. We had no memory of it. We see a lot of Amish people. So you see how it is different in different cultures. We have a pain nation. Our whole nation appears to be in pain. We're a lot more sensitive. You go to other countries and it's totally different. It's an important thing, frankly, to know. Let me teach you the difference between acute and chronic pain. What's acute pain? Acute pain is, you fall down, you break a leg, you break a hip, you're an elderly person, and they have severe pain. That's acute pain. We fix the problem, and the pain goes away. So acute pain tells you where the problem is, and if you treat it properly, usually the pain from it is gone when the condition is healed. So that's easy to treat. Sometimes you have to use narcotics. That's okay. Rarely do any people become addicted, and that's fine. But chronic pain is a horse of a different color. That's a horse of a different color. That's pain that's been there for months. Usually the breakout point is 6 months, but some chronic long-term pain even starts at 2 or 3 months. It's a different thing altogether. It's divided in a number of different conditions. We have neuropathic chronic pain. Now, neuropathic means nerve damage. If you amputate a leg, and the nerve can be very painful starting months later. It may not hurt the day they do it, but months later you start getting this pain syndrome. It's gnawing away at you. It can be trigeminal neuralgia, facial pain, for example, is neuropathic. Diabetic neuropathy, where there's actual nerve damage from diabetes, can be neuropathic. Now, these patients many times will need narcotics for maybe a short period of time, sometimes a little longer. I prefer it be used for a short period of time because you become sensitized to the drug. Narcotics cause sensitization. In other words, you're in a certain amount for a month, next month you need more, and then you need more, and then you need more. Before you become habituated, become tolerant of the medicine, I mean, you may turn into an addict. Besides, there's a rule called a 30-30 rule of pain research. And it says only 30% of the patients with neuropathic pain are helped by narcotics 30% of the time. Why would you want to use narcotics? Maybe except for short term, to avoid addiction and sensitization by the narcotic. It concerns me a great deal when narcotic prescriptions are handed out too readily. Don't take them unless you absolutely need to. Nociceptive pain, that's part of chronic pain too. Now, nociceptive really means that the nerve receptors that conduct the nerve impulse to the brain. For example, what's nociceptive pain? Arthritic pain. There's a nerve receptor that picks the pain up, rheumatoid arthritis, for example, tennis elbow. That's all stimulated by a nerve ending that sends an impulse to the spinal cord, to the brain stem, and then to the brain. That's nociceptive pain. Occasionally, you treat those with a narcotic short term, but you should not use narcotic medication for long-term pain because the patients become sensitized and addicted and habituated to the medication. Now, but acute pain is 10%. Neuropathic pain might be 20%. That's being generous. The psychiatrist, Dr. Snyder, told me recently he thinks around 10%. That leaves 70, 60% of the people where we don't know why they hurt. Now, that's a real problem. That's a real problem because these patients come to the office, say that dying from pain. We now in medicine, the Joint Commission put out this 5th vital signs used in the hospital. The nurse asks, well, what's your level of pain? You say 8 or 9. She calls up the doctor on call and he orders morphine. Is that a problem? Makes the patient feel more comfortable. It's a real problem because of that. If you don't know why the patient hurt and you start giving him morphine, you could start the addictive process. So the 70% of these people concern me a great deal. What concerns me about them too is this group of people hit the emergency room and they go to chronic pain centers and they start doing things to these people and they don't even know why they hurt. That concerns me a great deal. No one's formed. I read recently again 3 pain books, which I've read many times before, this thick, 3 of them. No mention of this 70%, no mention without diagnosis. They consider pain to be a diagnosis. Well, that's ridiculous. You got to know why they hurt. If all it takes is pain, you can addict them with drugs. There are indeed emergency rooms in this city. And I had a nurse write me a 5-page letter recently describing it, where she, when she works at this certain hospital on the edge of Fort Wayne, where in her shift of 8 hours, every patient came in requesting a narcotic for some pain they couldn't tell for sure was due to, and they gave it. There's a sign on the wall that says, be sure to tell your nurse the level of your pain. That may fit the 5th vital sign, but that is extremely dangerous because it's part of the addictive process. And the nurse witnessed this and wrote it to me. I was aware of it, but I indeed have it in writing. So I made up a name. I call it metabolic pain. I don't like to call it psychological pain, neurocircuitry pain, or some other thing, because you can't be absolutely sure what's due to. It's change of neurocircuitry of the brain. Stress, anxiety, hopelessness, depression could be the cause of it. Many different causes. So I prefer the name metabolic pain. I don't think that's really too bad. I ran it past psychiatrist Dr. Snyder, who's very knowledgeable about pain. He treats the serious complications of addiction. And he said, not a bad idea. And as I mentioned, if you don't know why the patient has the pain, if you don't know why you have this pain, don't accept a narcotic, don't take a narcotic, and don't give a narcotic, because this is the start of the addictive process. Remember, across the country, the biggest cause of drug addiction is not the guys from Mexico or Colombia, it's a medical care providers' prescriptions. Look at Michael Jackson. Look at Marilyn Monroe. I could name you 100 actors, very famous people who died from this, and it's happening all around me and in this town, and I see it on a daily basis. And that's why I'm doing this DVD, trying to help you. Let's move forward here. So the definition of nociceptive pain, remember I said, is a term for pain that is detected by specialized sensory receptors in that part of the body where the problem is. These nerves are located through the soft tissue, such as muscles and skin, as well as internal organs. I mean, you have a little cut, you have a pain, that's nociceptive pain. You fix it, and it's gone. The pain is gone. But you don't generally need narcotics for that, except maybe a week on an occasional case. So what about pain centers? We have a lot of pain centers. We have thousands across the country. In Los Angeles, a patient told me there's one on every street corner. On every street corner. You think, oh, it's a wonderful thing, a place we could have pain control. Even the state of Washington, there's somebody on their state committee that thinks every patient who has pain should be sent to a pain center. They go from there. That would be a horrible mistake. They'd addict the whole state. And I'll tell you why. Because you get good ones and you get bad ones. There's a lot of money in pain. A lot of money in pain. There's a lot of money in injections. I know of a place that does 50 to 100 injections a day. 2,000 each injection. 1,000 for the doctor, 1,000 for the facility, that's 2,000. Just add it up. Besides, they're writing prescriptions all day for narcotics. So that's another amount of money they're making. They're making fortunes at these pain centers. Many have satellite offices. Watch out for them in the outlying communities. I had a gastroenterologist tell me he was across from one in Auburn, and he watched the process. They were injecting somebody every 5 minutes, and they had a Rolodex of prescriptions, narcotic prescriptions. They were rolling off, talk to the patient 20 seconds, and hand them a narcotic. This is reality, my friends. This is reality. So you have good ones, bad ones, and in-between ones. I said half of them probably reasonable ones, but it's tough for the patient to tell. It's tough for me to tell. I know of pain centers where I find certain evenings we're doing refills, they have the people walk in the hallways because they're so busy in the pain center. They generally schedule 5 people at the same time because many don't show. They can get the money. They're not going to give you the prescription if you don't have the cash. So they schedule 5 at a time. I have seen patients lying in the hallway. They all look alike. They all look pale, they're staying straight ahead, they all get tattoos, they all smell from smoke, and obviously they've been addicted and habituated by drugs. Don't get into this crowd. It's not those people's fault. They were created largely by the people who wrote the prescriptions. Don't get involved with that. My patients call pain centers cash cows that addict people. I didn't make this up. I've been listening to this for years. They tell me that. What's the cause of this? Why can pain centers get away with this? How can the 70% of people go there and they don't carry a diagnosis? I'll tell you how. A lot of it is due to the overreading of the MRI scan by the radiologist. Most of them don't do that on purpose, but I have talked to some. Actually, they've been requested by the pain centers and the surgeons to read them a little more closely, to give them a reason so they can send out a bill. If the x-ray is read normal for your age, you couldn't send a bill, or you couldn't treat it, could you? You have to have a code to send a bill out. That's a true story. That's a a true story. So the overreading of X-rays, which I call a nocebo. A placebo is a pill or me that can heal. Believe me, I placebo a lot of people. They believe what I tell them. They know I love them, and they get better without doing nothing. That happens to me every day. So a doctor can be a placebo. A pill can be a placebo. Occasionally, a procedure can be a placebo. You can inject somebody, and they say, "Ha, I'm cured." Does that mean the needle did it? Heck no, it doesn't. You could just believe. Placebo effect. A lot of these injections, some people say they're better. A lot of them are due to placebo effect. After all, what does a needle do? I mean, Jesus. You inject a little bit of steroid, you can do that, give it by mouth as a pill. But these overreading of the X-rays, the doctor will look at it and shows the process of aging. You get degenerative disc disease. That's the cause of your pain. When in reality, most chronic pain, long-term pain, isn't located in the spine where they're treating you, where they're injecting you, where they're doing rhizotomies, cutting your nerve roots with a needle and electricity in your spine. Most of the pain is up here. It's real, absolutely real. It's due to the neurochemistry of your brain, but they're treating the spine, the wrong place. They're treating the wrong area. So the overreading the films is called a nocebo. I will harm. It's used as the excuse to make it look like you have neuropathic pain, when in reality you have chemical or what I call metabolic pain, which we best treated by stress reduction and massage and wellness treatments of little risk. You don't need a spinal injection when 2/3 of your pain or even more, frankly, existing in the circuitry of your brain. It's real. You're not making it up. So the placebo, I believe, and the nocebo, the negative speak, are critical throughout medicine. I wrote a book called Nocebo, the Evil Twin. Isn't that a great title? I mean, that's a great title. I mean, it is an evil twin. It's a twin to the placebo. I will heal, you believe, and nocebo, the X-rays are abnormal, they hand you a report. You get a full 4-page report. You look at it, you know nothing about it. You obsess for a month before you see me, and you think you're dying. I look at it and say, and what's going on in your life? Well, I lost my job 3 months ago. My mother died a week ago, and you get a backache and a headache. And I'm trying to tell you it's on the X-ray. Give me a break. It's in the neurochemistry of your brain. You have fibromyalgia or tension myositis or stress or hopelessness. It's not on that MRI, the nocebo. I hope you understand where I'm coming from here. That's the cause of the great deal of the over-treatment of injections and operations and medication. The excuse. The placebo sort of makes it seem legal. Don't fall for that. Get some other opinions. What's the gold standard of treatment of pain centers? I read a book by Dr. Snider, this thick anesthesiologist. I've read it probably 3 different times. She said the gold standard of the treatment of chronic pain is the word of the patient. Oh, for Pete's sake, what are you thinking? These 70% of the people, we don't know why they hurt. They're going to say, I got a 9 or a 10 or a 12 or 15, and I'm supposed to give them narcotics? Give me a break, Dr. Snider. That's why we have so much addiction. It is right there. That is why we have so much addiction. It's not, I hurt. That's not the answer. That's not a diagnosis. It's a symptom. It's a symptom. It's not a diagnosis. We need a diagnosis. Pain is not a diagnosis. I read a book the other day, a big old chronic pain book says pain is the diagnosis. Give me a break. Anybody can say they got pain, you have to have a reason. Then proceed with proper treatment, whatever it takes. So the causation of pain as a diagnosis is ridiculousness. Narcotics cause sensitization of the body. Remember I mentioned that? So it's very poor to use them on a persistent basis, but it's rampant. Everybody's on Vicodin and hydrocodone and OxyContin. I saw 3 patients on it today. Some from the VA. I saw a gentleman today. He should not be on all this medication. He clearly is addicted on his medication. I saw a guy the other day, he had a light injury. He comes to see me, and his doctor immediately sent him to the pain center. Major mistake, because he came back with 5 pages written out by his wife of procedures he'd had done at the pain center on 5 drugs. OxyContin, oxycodone, Ambien, Xanax, Neurontin, and Lyrica. And he's just shaking, just shaking. This was a working man involved with a light injury. He should have been sent for holistic healing methods, which we're going into very quickly here. So what are holistic healing methods? I'll go through a number of them for you. Exercise is really a good one because exercises increases your endorphins and your own morphine. You make morphine in your body, endorphins. And these receptor sites were discovered by Candace Pert. She wrote a book, Molecules of Emotion, 1972. This is where morphine works from our own body. How do you bring it out? Breathing techniques. Lamaze, you're going to have a baby, do some deep breathing. You may not have any pain. I have seen it. So exercise increases your strength, your muscle mass, holds up your spine better. You're going to have less pain. So exercise is a good treatment for chronic pain problems. I see many elderly patients with chronic pain in the back. So what do? Send them to a pain center. They inject them and hand them narcotics. What would be proper treatment? To send them to a wellness studio like ourselves, or physical therapy, and train them to strengthen their muscles, and the pain would go away. The pain would go away, and the pain would improve. It's not proper treatment to send them a whole bunch of injections and start doing things to them. First, you should try to increase their muscle mass. A good warm-up, then stretching. We need to get loose as we get older. We all get a little stiffer as we get a day older. Obviously, at age 39, everyone knows a bit of stiffness. But I do personal training with a yoga instructor once a week, and then 2 or 3 other days a week. I do my own stretching and weightlifting, and I play tennis regularly. And I feel pretty loose, and my muscles feel fairly strong. Muscle mass and strength is very important in the aging process. Exercise burns calories and causes weight reduction. Get the weight off your body, the pain becomes less. Also, exercise improves your metabolism. For example, if you have type 2 diabetes, exercise is critical to get your body weight back down, and the metabolism of sugar is improved tremendously. Also improves your VO2 max, your oxygen consumption. Improves with exercise and aerobic activity. You can breathe better, your heart becomes stronger, and if you increase your muscle mass by 1 pound, that will burn 80 calories at rest without doing a thing. So increasing your muscle mass is very important for weight loss, increase your strength, induce spinal pain problems you may have. You can increase your muscle mass, believe it or not, into your 90s, 100 to 300%. I found that in the physiology book. Would you believe it? We're going to have lost about 30% of our muscle mass as we get older. But if you exercise, do some light weights. I'm not saying heavy weights, light weights. Every other day, 8, 10 pounds, do reps over your head, biceps, triceps, do the lower extremities, stationary bike. You can double and triple your muscle mass. If you work out at 80% max of the max, if you can lift, say, 10 pounds, that's the most you could lift here, okay? That's the most. If you train at 80% of that, your muscle strength will increase 3% a session. Unbelievable. Unbelievable. 3% a session. I mean, that's just fantastic. So working out is very important, and it improves pain problems, tremendously. Brisk walking is the easiest thing, of course, to do. So let's try massaging. That's a good holistic pain treatment. It's underused. We frankly need to do more of that. It beats what a massage does, the touch and the impulse. It beats the pain impulse to the brain. It gets modulated differently in the spinal cord. And the impulse beats it to the brain and makes you feel better. Polotherapy is another way of doing it, is where you inject some steroid into areas very sore, and then you do vigorous massaging, an excellent way also of conservative treatment. It loosens up the tissues, the adhesions. As we get older and injuries, we develop fibrous adhesions and become much stiffer, and that's painful. It's painful. But you can loosen these things up with polotherapy, exercise, massages. Russian massage is very rapid massage work around joints. They massage very quickly and it breaks up the neural circuits, and you feel better. Swedish massage is long gliding strokes. These are all different methods of holistic healings. They should be at the top of your list if you have a pain problem, especially in the spine and headaches. Therapeutic massage is applying pressure at specific points in your body. Very effective method. Great for muscle spasm, pain. And I love getting massage. I think it's a wonderful thing. It reduces stress and tension. If you don't feel better after a half-hour massage, that'd be a rare condition. So massages are mentally and physically relaxing. Tell me about it. I tried. I go to a place in Fort Wayne, and they follow it with a nice hot tub bath. And I mean, it's like going to heaven. Took no drug. and a fantastic thing you can do. So massage is universal treatment for chronic pain all over the world, all over the world. Try a massage every other week, because they cost a little bit, I realize that. But you know, your wife and loved one can give you a massage. You know, it may not cost that much. And limited massage for breakthrough pain. If you can't afford it, limit it for when you're having a horrible problem, you know, once a month. And there always can be a neighbor or somebody who's in that business who might do it for $15 or $25 and not the 60 or something it might cost you if you went to some other place. So massaging is very important. Myotherapy is specific, loosening up the tissues, less stiff. It's more deeper massaging. They work at certain trigger points, like a fibromyalgia. You might find out where your trigger points are and massage that area. It's called myotherapy. Myofascial release, deep, more special work. It can break up the pain circuits. It's almost like a circuit breaker, and the pain goes away. And you may be massaging in the thigh area or the buttock area, and the pain in your neck may go away. It's a circuit breaker of the pain impulses to the brain. Very effective methods. Myofascial release is another form of soft tissue therapy used to treat somatic dysfunction involving with pain. And myotherapy is even more specific, and with standard methods of evaluation are used, such as orthopedic tests, postural assessment, neurologic and functional testing, and with a thorough palpatory assessment of the spine, peripheral joint play, and the contractile elevation of musculature, and improve your range of motion. And with massage, I mean, this is getting more technically. A therapist would frankly have to do this. You can't just go to any average massage person. But that's getting a lot more specific if you have a specific problem. But use this for chronic pain instead of taking a narcotic. And what about the power of touch? The skin is the largest lesion of the body. Yes, the skin is the largest lesion of the body. That's a lot of us. If we think negative, we have stress, we develop rashes. That's neurodermatitis. So the skin commonly reacts to our thought process. And all humans need to be touched. Human touch has tremendous value. You remember when the communists took over in Europe, and they found all these children in orphanages, and they had just been dumped in there. No one had touched these children, and they all had horrible cerebral dysfunction from lack of human touch. It's very important. Self-massage is helpful. You can learn to massage yourself, and that's certainly a lot cheaper. And I teach elderly people to do this a lot. And it helps really better if someone else is doing it. But for pain problems that you can reach, a good massage for a few minutes gets endorphins flowing. You can feel a lot better. I mean, we've all done that probably in one form or another. And 4 hugs a day is healing. Some families are very huggy. I had a house burn one time, and I lived in the house of a family that just was in the habit of hugging a lot. I must say that I didn't come from that kind of family, and I found it to be wonderful. Hugging people has great value. This man I talked about earlier that was on these 5 medications, had been in these pain centers, and I made him so much better with my holistic healing methods, and I barely knew this man for a month. He must have weighed 250 pounds, and he's there with his wife. When he got up, and he had him off the morphine already, and he was cutting down his Cymbalta. As he was going to leave, he said, "Doctor, could I give you a hug?" I mean, I loved it. I loved it. I will admit today, I saw a very pretty girl that maybe 4 years ago weighed 190 pounds, had 3 ruptured discs. It seemed like she had very weak ligaments or something. And I asked her, and I taught her a high-dense nutrient way of eating, and she moved out of town to Illinois. She went to a pain center. They had addicted to everything moving. But when she came back, she moved back into town, she had done one thing, and I still have some drugs to withdraw from her. She had done one thing. She came in, she looked like a movie star. She weighed 125 pounds. And then I remembered my preaching of her, of what to eat, and she said, "Doctor, this is due to you." And I said, "It's not due to me, honey. You did it." But I ended up with another hug today from a beautiful girl, and because she followed my advice. And so hugs a day, I think hugging is a good thing. Hugs are better than a shot, especially in children. Your child cries, you hug it. Obviously, it works. We all have experience with that. Acupressure. traditional Chinese healing technique where they press on painful areas and part of the body. Firm, sustained fingertip pressure, and sometimes they do it in a different part of the body than the problem is, and it works anyhow because they think the qi, the energy, when it goes up the meridians, energy lines along your body, and it's healing. This is 5,000 years old. This is nothing new, and it works. We need to take advantage of that. And so the energy, the qi, flows through the body. They have these meridians that go to chakras, energy centers. You have an umbilicus in the heart, the top of the head, and the face. And the sacral area, these are chakras, energy centers. This is Asian medicine speaking, Chinese medicine speaking. They feel it releases blocked energy. Don't close your mind to it. I've seen it work many times. It don't hurt. No complications involved. And a very safe technique. That can cure 50 to 70% of the people. So it can be very helpful. You can find a person who does this, take advantage of it. They may massage the trigger points and with acupressure release the qi, the energy, and you feel better. Again, you take a no narcotic, a wonderful method. So it distracts the nervous system, the neural circuits, the perfect barrage of sensation to keep the thalamus regulated. That's the central part of the brain where pain circuits are regulated. Maybe it's a circuit breaker. That's my idea. I think it's a circuit breaker. I mean, if I could press it on your foot, for example, massaging it and doing trigger points and de-massage, release a pain in your neck. It does, because it's breaking up the neural circuits, the energy and the qi moving through your body. I truly believe this is correct. Shiatsu is acupressure Japanese style, and they use the elbows and the feet, and they may walk on you very interesting and can be very effective. This is a holistic method of saying, doesn't this beat narcotics? And Pilates, we all have heard of that. This is kind of interesting. It's named after the creator, Joe Pilates. Okay, it's an exercise system that focuses on the core postural muscles, the big muscles, and they do yoga with it and exercise, and they move quickly and they dance with it. It improves your balance and gets your spine in healthy alignment. Pilates was first developed in the early 1900s to improve Joe Pilates' health and that of fellow World War I prisoners of war. And since then, I mean, it's done everywhere. It's done in this town. It's done in my wellness studio. Pilates is an excellent way of healing, improving chronic pain. It does stretching, meditation. It improves your musculature. Remember I said how important it is to increase the size of your muscles because it burns calories at rest, improves your oxygen metabolism. It's one of the top biomarkers of healthy aging, mind and body, improving muscle mass. Very important. Look at my website and look at Rudy's Brain Gym. It's #1 biomarker on longevity. Very interesting. And it's regained popularity throughout all these and is becoming more popular all the time. So it's stretching muscles and tendons, building muscle strength, great awareness of the movements of meditation, good for osteoarthritis, especially for back pain, headaches, just to make you feel better because you secrete your own endorphins. And it's mostly done in groups, but a one-on-one be best. If you could afford an instructor, I mean, it's the best, but the groups are great. Maybe the groups are almost as good. I work in groups at my wellness studio doing Pilates, and it's wonderful. So the meditative stress relieving effect, you can do it weekly, a couple times a week. You'll be in great shape. And again, it's holistic healing, gets you off of medication, and you don't have a need for medication. Biofeedback is another method. It translates information of your body to visual and auditory cues. It's done with a computer, and electrodes hooked to you, to your pulse and to your skin temperature, and it's connected to a computer. So how you think and breathing techniques, and the computer picks this up, and you can see your heart rate slowing down. You can see your temperature changing through meditative and breathing techniques. You can visualize. You can see your tension come and go. They can put a lead on you, and you see your muscle tension going down in the screen by your thought process, by breathing techniques, hyperventilation techniques. Very effective biofeedback. And there are practitioners around. Very effective treatment for relaxation, stress reduction, pain control. You can literally, with your mind, learn to control your body. So you can also hear it. It has auditory cues to it. You can hear your tension come and go. It's affected by your breath and thoughts. You learn to regulate your pulse and temperature. Sometimes they use EMG, nerve conduction studies, biofeedback. You learn to control your muscle spasm, to reduce the spasms of your back. Again, you're getting no injections, you're getting no narcotics. Look how safe that is. You can learn to, some people have very bad bladder spasms. You can learn to control those with biofeedback. Good for any part of the body that is tense, back pain, headaches, heart pain, bladder, jaw pain. Very effective method. Breathing techniques really cause secretion of your own endorphins, your own morphine. And so it's a very good technique. Remember we talked about Lamaze, breathing to release your pain having a baby. I had a chiropractor's wife recently. I went to see the baby upstairs when I saw her husband downstairs. And she said Oksana, what type of anesthetic did you use at a Cashman? I attend your lectures. I just meditated, did deep breathing. I had no pain. And she meant it. I don't suggest that for everyone, but for some pain problems you have, instead of grabbing that narcotic, how about trying some breathing techniques? Breathing techniques work better with meditation. Meditation is not thinking of the past, not thinking of the future, maybe saying a mantra, repeating some words to quiet your mind, doing some deep breathing. Then visualize your breath. Maybe visualize something you'd like to happen in your life, weight loss, something better, a pain moving out of your body. That can be done. The pain is disappearing top of your head, or you're urinating your pain out, or you're visualizing getting rid of your cancer. You can make it happen through breathing techniques. So good breath work comes from the diaphragm, not from the top of the chest. So breathing in meditative breathing techniques, as you're taking your breath in, don't pull your diaphragm up. Drop it down. That's the way a baby breathes. So breathe like a baby. We'll speak more about breathing techniques. So the abdomen rises and it falls in inhalation like a baby. 4 square breathing. Really what that is, count to 4 breathing in, count to 4 breathing out, and do about 4 sets of that. If you're not relaxed by that time, I would be surprised. Zen breathing for insomnia, that's sort of 4 square breathing, except you take 10 breaths to quiet your mind and relax you. And if it doesn't, first 10 sets or 4 doesn't do it, try it once more. You'll be asleep at the end of that. I use that sometimes after a stressful day. Purifying breath is another method where you feel like the breathing in, you're bringing in the white light, and then as you're breathing out, the black light leaves, and that's all the stress and pain of your body. A good visualization. Visualization is a language to your unconscious mind. You're much more likely to happen. That's how you speak to your subconscious and unconscious to visualize something. It's like playing tennis or golf. You visualize it, it's much more likely to happen. And yoga teachers are the breathing experts. They can teach you about breath work. They're really the expert on that because yoga is a lot about the breath. Cognitive behavioral therapy, what's that? That psychological therapy treatment. It's the interpretation. It teaches you the interpretation of events is more critical than the event itself. For example, when they torture somebody in the war, unfortunately, these things do occur. It's the anticipation, interpretation of what's going to happen, like waterboarding, that seems to break the prisoners down, and they start talking. Then the event itself, the anticipation of it. So the interpretation of the event is more important, really, than almost the event. So how you think is important. How you think, that's how you are. I think as I am. That's Descartes talking. And so your belief about pain, its impact on you. Think about it. Is it rational? Am I obsessing about this pain? Is this pain really as bad as I believe it is? Can I not work because of my belief? What's the diagnosis? If you don't even know the diagnosis, don't obsess about your pain. You may be destroying your own thought process and feel like you need narcotics or injections or you can't work, I'm disabled. So your thought process is very important in the pain business. Very important. Do you have irrational thoughts about your pain? Maybe hard for you to interpret it. You might ask the doctor or a friend, hey, am I irrational about this? Am I obsessing about this? Is this too much? I see a lot of people that are obsessed and have irrational thoughts about their pain. They feel they're so disabled, it's unbelievable. Yet you go to other cultures in Asia or the Amish, and I saw the father-in-law of an Amish child, a recent opera, and he comes in here with his arm up like this from a broken arm and a nerve injury. and I asked him if he had any pain. He had no pain. I can't believe it. His for 2 months, the arm's up here in this cast and stuff, and this guy's got no pain. I got a pain here already right now. So he says, I'm too busy to have pain. He works regularly running a furniture factory in Napanee. It's a true story. And let's move on. So guided imagery is another method. Imagination to cause bodily changes. You can image and imagine things and make them happen. And visualization is important to that. You want to get rid of this pain out of your body. Breathing techniques and are helpful. That visualize, quiet your mind, and visualize the pain leaving your body, going out of the top of the head, or urinating it out, and you can make it happen. Your mind speaks to your body through neuropeptides, through hormones and neurotransmitters. How you think is everything. Your brain, if you wake up pessimistic and painful, your 70 trillion cells will receive that message, and your whole body will be painful. If you wake up to music and you feel more optimistic, your whole body will feel that way. So what you visualize, what you see, how you think is critical. For relaxation, for example, think of a safe place and see it. See it with your mind's eye. Put yourself into this. Put yourself into this, and it'll make you feel better. And use a lot of details. Visualize, see things, do auditory things. There's a Sergeant Gordon, you would not believe this, who was in a prison camp having a horrible pain problem from broken legs. And he was in prison camp 7 years. He visualized every day playing golf at 9 a.m. in this prison. This is a true story. It's in the book. He visualized playing 18 holes of golf. But he did everything. He could smell the flowers. He could see the ducks and the geese. He could see the grass. He could hear the wind. All his senses. He played every hole in great detail. He did it for 7 straight years. It took his pain away, and to top it all off, when he comes back, plays at his favorite club. First time out, the guy shoots 5 shots under what he usually played. It's a true story. It's in the book. So visualization is a great way of training. I mean, many famous golfers and Olympic people, they visualize what they do. Thorpe, the famous athlete, went to Europe on a boat in 1940 to play in the German Olympics. Everybody in the boat exercised from the Olympic team. He just sat in the corner, never exercised a bit, visualized everything he was going to run in and jump in, and guess what? Won them all. Won them all. I didn't say not to practice, but it goes to show you the power of the mind, the power of the human mind. So, very important thing to use to relieve pain. So in guided imagery, make a statement. I'm going to get well. This pain is going to be gone in a week. Put sounds and pictures in it. See it leaving your body. Do a visualization of a pain relief. See your pain as a fire, and see the water coming in and dousing it out. That's a great visualization. Use CDs and DVDs if necessary. Hypnosis is used sometimes. That puts you in a very hyper-suggestible state. You learn to control involuntary body functions. That things influenced by the autonomic nervous system, your blood pressure, your temperature, for example. And you learn to speak to your subconscious mind. It decreases your blood pressure, decreases your pain, decreases the heart rate. Hypnosis, I don't think, is used enough. We should use it more. I send people for hypnosis periodically. Hypnosis is deep concentration, and you're open to suggestions, but you're conscious. Your mind settles down, but it's open to new ideas. You may be so obsessed and irrational about your pain problem that under hypnosis, your mind settles down and listens to new ideas. It's a great way to stop smoking, for example. It's a good way to get rid of pain problems. You're fully aware of what's going on. It's generally safe, very few side effects. So good, again, a good holistic healing thing. No addiction, no medications. Meditation is an excellent method. Decreases stress, decreases heart disease, decreases blood pressure, decreases anxiety, stimulates of good neurotransmitters, neuropeptides, and hormones through the thought process. Meditation is not to think of the past or the future. It puts you into the present moment. Meditation is the present moment. Yoga is a lot to do with meditation because it puts you in the present moment. Then visualize something pleasant, It's much more likely to happen when your mind is quiet. You can't quiet your mind. You're so busy. Stop thinking. Repeat a word. That's a mantra. That's mind energy. It could be anything. It could be God, God, God. It could be Satnam, Satnam, Satnam. Pick a word. By the time you hit it the 20th time, probably what you want to happen, happen. If I want to drop my blood pressure a few points in the morning and I have a blood pressure cuff on and I've had a tough night and been stressed out, I then close my eyes, meditate, and say Satnam, Satnam about 10 times. My blood pressure drops 20 points every time. I've done it hundreds of times. Very effective. You can do it anywhere. You can do it in a car. So meditation quiets the mind chatter. Okay? Use a mantra, mind energy. We taught you that already. Good for chronic pain, long-term pain. Mindful meditation, very important. Observe the breath as it moves throughout the body. If you watch your breathing and pay attention to your breath, it helps quiet your mind. That's a trick the yoga instructors will teach you. They say, feel your breath going through your nose and breathing in and out. They're very important. So breath is the object of your meditation. That's what quiets the mind. It's breath techniques. Prayer and healing. This is very interesting. I totally believe in prayer and healing. If I'm going to do a brain tumor like tomorrow morning, and if their minister is there, and I think it's going to be because I talked to the minister today, and I asked him to say a prayer ready while we're in the room talking to the patient before surgery. But if he's there again tomorrow morning in the pre-surgical area, I will have that minister and everybody hold hands and say a prayer for the patient and for me. I do it every time. It's wonderful for healing. The patient will do better during surgery. He'll do better post-operatively. And of course, the family will certainly think they have a healing doctor on their hands. He believes as they believe. We're not the same religion. I picked the religion of the patient, not my religion. I wouldn't care if he's a Muslim or a Christian or whatever, or Jewish. I obey the religion of the patient. And this is, you should address your God and pray, and healing is very important. And people who attend religious services in general are just healthier. They just healthier. They produce positive neuropeptides, hormones, and neurotransmitter, and it's healing. When I drive past some of the churches there at Homestead, and I'm not at that religion, but I see so many people out there today, I got to be thinking, these people are just doing better. They're just doing better. And they produce positive neuropeptides, hormones, and neurotransmitters. They decrease the heart rate, blood pressure, decrease anxiety. My experience with prayer and patients, I told you that. I hold hands with my patients. I pray with them. I encourage nurses to do it. And I encourage you to do it. If you get a pain problem, pray about it. Talk to your religious person about it. Yoga, Tai Chi, Qigong. Remember, we talked already about exercise and meditation. A lot of these activities, yoga, Tai Chi, Qigong, you've seen these people in China and India moving in these very slow postures. They're very effective. It's meditation, it's stretching, it's exercise, it quiets the mind, causes secretion of good neuropeptides and hormones. Great way to get rid of pain. Great for back pain, any chronic pain. Yoga is multifaceted, has many aspects to it, many different types of yoga, many different positions. I do it regularly. It's very effective. And it can be done. You don't have to be an athlete to do this. They have, like at my Mind Body Studio, we have a very mild way of doing it, more vigorous. Then we've advanced, and any age is just fine. It's exercise, it's breathing, it's stretching, it's meditation, it's visualization, it's company, it's friends. It's very healing, not that expensive. You can do it in groups, 10, 15 bucks maybe. And you can do it at home. Once you get taught to do it at home. They have videos available too. But it's good to be instructed, at least in the beginning. So yoga eases pain, increases your strength, and increases your flexibility. There's a beginning, and then there's advanced yoga techniques. It's not religion. You know, I had a yoga instructor once, now when I work at my Mighty Institute, he's a good instructor, because he thought it's a religion. That's ridiculous. It's not a religion. It's a form of exercise and mental healing. It's not religion. And so Asian healing, the essence, the energy of the spirit, that's the Tao. That's the Chinese Tao, T-A-O. 5,000 years old. They connected the mind to the body 5,000 years ago. But we, in Western medicine, we cut the head off there, Descartes did in 1635, and we haven't reattached it. We treat the body like it's an engineering process, like it's a car. This head's attached to it. Remember I said about chronic pain? The brain is attached to the pain. When they're treating the spine, they're treating a third of the problem. 2/3 of the problem and chronic pain, long-term pain, is sitting up here. It's real. But they can't do a lobotomy, so they make the money doing things to your spine. It doesn't heal many people. That's why they get addicted. Why should they be writing narcotics all day long if they had a better way of healing it? They should have holistic healing in there, and they don't. Why don't they have it? They don't pay. It doesn't pay. Insurance companies don't want to pay for that amount to anything, and so they do the expensive $1,000 stuff on you and making a fortune. So let's connect the body and the mind. The Chinese have used the same pharmacy book for 2,000 years. Didn't change as much. So why is that? Why'd they get away with that? Because of the placebo effect, that people believed the medicine worked, and it did. They had some effective medications there, like malaria, different things, no doubt about it, and the different things that it worked. But many things only had a placebo effect. And if you go to the pharmacy in China, do it sometime. You go in the back. They get stews going and all sorts of things you can drink, green tea and things to make you feel better. Very, very good. Very few complications. Very effective to heal. So Tai Chi and Qigong, kind of get onto that. Maybe take some lessons. Maybe get a DVD. Very healing thing. And use of herbs. I recommend some herbs. Learn a few herbs. I don't want you to take 1,000 herbs, but I learned a few that might be healing to you. And I'm going to list some here, and maybe go to a health food store. You say, well, some of them are dangerous, but you know, there are ones that have been around for hundreds and hundreds of years that are quite safe. And as long as you believe they work, and some actually do work, is important. I use them. Sometimes I can't solve a pain problem. I have them get some herbs. And I had a guy recently, facial pain. 5 years he has this pain in his face, intolerable pain. Nothing worked. All the strong medications, nothing worked. And I sent him there, and he started taking some flaxseed and omega-3, and the pain went away. Again, some guy gives me a hug. Man, might enjoy hugging me. He gives me a hug. His pain's gone. And of course, I celebrated 5 years of pain. So a herb worked. Not expensive. How safe. I had a great day. Ayurveda medicine is another form of Asian healing. Chopra writes a great deal about it, and it's worth reading about. And it's worth reading about the Qi and the movement of Qi and the meridians and the chakras. It's very safe. It could heal half the people that go to a doctor in this country. It doesn't cost very much. If you can find a practitioner of this, give it a try instead of giving grandma 15 medications that might kill her. And believe me, I see it. And pain control diet. A diet is important. High nutrient dense diet is what I recommend. Low glycemic index, which means complex carbohydrates. You have the glycemic index where they give some sugar to a person to check their blood test, and there's 0 to 100. You want to eat things that are under 55. You can punch in a glycemic index in your computer, and up comes a website that tells you the glycemic index of any food that you eat. 100% whole grain, vegetables, beans, and fruit, all you can eat. You eat this way, you're not going to gain weight. Your diabetes disappear. Your heart disease is going to disappear. It's a great way of eating. I teach it at the Mind Body Studio. We get a lot of people doing that. I eat piles of food, but I eat this type of food. I had one of the doctors sitting with me, big pot belly today, and you can see it. I'm eating a pile of food. He's eating 3 pieces of chicken, and he's the guy with the pot belly. That tells the story. That tells the story. Difference in foods. So it eliminates all types of diabetes, eliminates diabetic neuropathy, reduces heart disease, vascular disease, strokes. Hard to have a stroke when you eat like that. So pain control diet, it's no accident of nature that fruits and vegetables have such sensual pleasure. What do we do through evolution? Everything that has fun to it and saves our lives, nature's put pleasure to it. It's sex. It's what we eat. It puts color to it. It makes it sweet. That's what makes us live a long life. Evolution has arranged this. Foods of color, berries, vegetables, tomatoes, peaches, excellent food as a pain diet, good as a cancer diet, good to avoid all these diseases we Americans are getting, a lot of which cause pain. This is an anti-inflammatory diet. It avoids autoimmune diseases, cancer, dementia, all if you eat this way. The rate goes down. This is proven in the China study. They studied 1 billion Chinese people, Colin Campbell from Cornell did, and they proved it by studying different communities. So what I'm talking about is for real. What about supplements? Multivitamins are good, B-complex, flax seeds, calcium, vitamin D, 1,000 to 2,000 milligrams a day. GLA is anti-inflammatory, niacin, magnesium, vitamin B12, ginger, glucosamine, and chondroitin. I mean, I could list many more. I don't want you to overdo it on this, but take some of this. If your pain isn't going away, try some of this. It may be magic in glucosamine. For example, I've seen it be magic. Acupuncture is, again, moving qi around the body the Asian way. Again, the meridians and the chakras, moving qi through the body, the energy centers. Blocked qi is thought to cause disease and pain. Is it a placebo effect because you believe? Could be. I don't know. But if it works and it's cheap and it don't hurt, try it. Beats narcotics and pain centers. And it's a modality that should be used. Good for headaches, rashes, pain problems, quite safe. There are a few practitioners in this community. I wish there were a few more. An unbalanced life leads to unbalanced qi. That's the Chinese way of thinking, the Asian way of thinking. So it's good for dental pain, myofascial pain. Some people have used it for anesthetic in China. And for arthritis, other joint problems, painful injuries from accidents, it's quite effective. Electrical stimulation using a TENS unit is quite popular. You can get it in physical therapy. Beats the pain impulse to the brain. It's something you wear on your skin, has a battery associated with it. It's quite safe. It should be used early in the pain problem. Instead of getting an injection, try TENS unit. And some people think it's just magical. They love it. Very low risk. And I don't mind you using that. I just don't want you to get 20 pain epidural blocks and things. So reduces muscle tension, good for back pain and headaches, very safe. Used early in the treatment program. Many have to worry for pain when the unit, don't have to worry about anything when the unit is on. It's a combination of placebo and reality. Reflexology is another way of treating it. It's holistic therapy. It has a lot to do with massaging your feet and trigger points. A purpose to treat the whole body. There are practitioners of it. Acupressure is another method of treatment. It's a pressure point practice, as a reflexology is all about. Again, it's about moving energy and qi. Reflexology is something where if you can find a practitioner, it's an excellent way to treat chronic pain problems. Music is an excellent way of healing. When I have a stressful day, I get in my car, I turn music on, within a minute, my stress is gone. I'm conducting the orchestra, I'm visualizing the band, and my pain just disappears. So please use music. And water therapy is safe, relaxing, massaging, water jets, hot tub, pool exercise is an excellent way. There's some medications, which I list here, Flexeril, Norflex, Valium, and very effective ways of treating. So in summary, really, thank you for listening. What am I saying? Instead of heading for narcotics, injections, and procedures, maybe they can avoid it by holistic methods of treatment. I've listed many for them. You can look at our website, CashmanMindBody.com. We have many of these modalities available. They're not addictive, and they can cure your pain problem. I think the narcotic addiction rate in this country, not just this community, concerns me a great deal. Thank you very much for listening to me. Please attend my free lectures at the Mind Body Institute at Lutherans. They're my website, CashmanMindBody.com. There's a lot of educational material there. I love you all. Thank you so much. Namaste.